As this new school year begins, mental health professionals are bracing for higher demand for their services.
There's typically a lull during the summer, especially among teens and children, and then a surge once school starts.
KCTV5's Carolina Cruz talked to two doctors about the impact COVID has had on kids' emotional well-being.
The coronavirus has killed grandparents, sons and daughters, family and friends, and it continues claiming lives. One of the effects, which may be tougher to measure, is the impact on mental health. What started in the spring of 2020 remains in the fall of 2021. Students returning to classes this school year will have their third go-around with the deadly coronavirus.
Certainly we're seeing, kids who've had their entire life disrupted.
Dr. Mitchell Douglas specializes in child psychiatry. He treats patients at KU Marillac. Even though it's one of the largest acute inpatient child psych hospitals in our area, it's been full for months.
We saw a lot of kids coming in much sicker than previously.
He saw COVID-19 weigh on kids' mental health and make things worse for students already suffering from anxiety, depression, and stress.
Our hope is to get kids to come in before they hurt themselves.
Dr. Douglas's colleague, Dr. Danielle Johnson, is a child psychologist treating inpatients and outpatients at the University of Kansas Health System. She says kids experience the same flood of emotions as adults, but without the maturity level to process them.
A lot of sadness, a lot of grief, a lot of just worry.
With a new wave of infections and restrictions this fall, parents may repeat what they did early in the pandemic. Many were afraid to take their child to a hospital setting because of COVID-19. For younger patients with mental health conditions, it resulted in weeks of treatment rather than a few days.
We had lots of children that weren't able to be admitted because we were at capacity.
The longer stays limit the number of available beds and how quickly services are provided. Patients are being put on wait lists, sometimes for months. The inpatient Marillac campus has 84 beds, but has been operating at half for social distancing reasons. Doctors are preparing for the annual upsurge in patients when school starts, as teachers identify students who need support.
We're going to see a higher rate of cases in schools.
This year, it could be greater as the pandemic exhaustion sinks in and new variants take hold.
We're going to see a lot more kids quarantine, which once they're quarantined, they're again back at home and the isolation that will happen. So there's concerns with school starting back. If there are not some mitigating factors in schools, we're going to see kids with increased anxiety because they're going to get quarantined.
Doctors are urging parents and guardians to talk with your child about how they're feeling and, if needed, seek professional help early. Carolina Cruz, KCTV5 News.
So tomorrow we look into the ways that you can talk about mental health as a family and the warning signs that your child may need additional support. And there is help available for those who need it. The number for the Suicide Prevention Lifeline, 1-800-273-TALK. It is free, confidential support available 24 hours a day. You can always chat with a counselor online at suicidepreventionlifeline.org as well.